Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is brought to you by AACN's online course, Essentials of Critical Care Orientation, or ECHO, providing modular, interactive, case-based orientation for ICU or PCU patient care, with information available at www.aacn.org/orientationcc. Now here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to Voices in Nursing, where we amplify the conversations shaping nursing practice, leadership, and the future of care. This is Dr. Vicki Good, AACN's Chief Clinical Officer, and I am joined by Kelly Swink, one of AACN's Clinical Practice Specialists.
Today, we're excited to welcome Jerri Westphal. Jerri began her nursing career as an LPN. Today, she is a Northern California Regional Director for Clinical Informatics and Chart Accuracy at Kaiser Permanente, a DNP candidate whose doctoral work focuses on AI literacy in nursing informatics, and an adjunct professor teaching health informatics at the University of San Francisco. That journey from the bedside to building the system that support it, exactly why her perspective on AI is different from anyone else you'll hear on this topic. She hasn't just studied how technology affects nurses. She has been that nurse. Today, we're going to explore what every bedside nurse needs to know about AI. Not to become a data scientist, but to become a more informed, confident advocate for their patients. Jerri, before we get into all of that, tell our listeners a little bit about yourself and that journey.
Sure. As mentioned, my name is Jerri Westphal. I started as an LPN in the Midwest. That's where I started my nursing career, and I really have done my career in baby steps. So I went from an LPN to an associate degree RN, started doing travel nursing, and then decided I should go back for my bachelor's degree. And that's when I discovered informatics. I had my first informatics course in my bachelor program, and I got very excited. I got very excited about seeing technology in practice and how there was an opportunity to merge my excitement for computer sciences along with my nursing background. So further went into nursing leadership roles as I landed at Stanford Healthcare in 2012, went into informatics, and then was able to join Kaiser recently about 10 months ago in the regional role for Director of Clinical Informatics.
Jerri, I love your journey, and I'm from the Midwest and have worked with many, many LPNs through the years, and I see them progress through their careers. So I love that for our listeners, because I think it really shows that you can start this journey from anywhere. So, well, today you walk into a hospital and AI is already there, but I think most nurses don't realize that it is there. So what are we walking past every single shift that we don't realize is AI?
Yeah, surprisingly, which starting my DNP in AI literacy, I was not too familiar with the background of healthcare and AI, but really finding out that we've been using it since the 50s. So yes, to your point, you have encountered it if you are practicing in any type of healthcare setting. And where that really shines is our expert system, so our clinical decision support. So if you've received an alert of some sort to notify you to do something to encourage best practice, you are using AI in some form. Of course, if you're in the OR suite, there's a lot of robotics use cases that also falls under that arm of AI. So it's not quite as scary as it can feel, because we have now it's been there for the last 70 plus years, and I think we're just becoming really, really aware of it now.
What do you think surprises nurses the most once they learn what actually counts as an AI tool in their workflow?
I mean, probably the same as my surprise, finding out that it's been in use and we've been using it daily, and what actually does AI mean, right? I think a lot of the generative tools are moving very fast, and what people are thinking about now and use cases for that. But when you really go back to the basics of what is under the entire umbrella of artificial intelligence, we've really been using these tools, and we've been using them and perfecting them. And nurses have always been involved, right? So I think that's the most surprising part.
I know I'm guilty of this in my everyday life. Sometimes my kids or my husband will hand me something, and they'll try to tell me how it works. And I say, I don't need to know how it works. Just let me use it. Let me get used to it. But how is that mindset dangerous for a nurse with AI in the hospital?
Yeah, really to safely use AI, we have human in the loop, right? I'm a huge advocate for having nursing at the bedside when developing these new technologies and in terms of governance. But it does make things up, especially when you're looking at these generative tools. We call those hallucinations. So what it wants to do is based on the prompt or based on the criteria, it wants to fill in something. It wants to be perfect. And so if it's filling in something and we're not taking the time to understand that part of it or the part of what it is producing, that's where we can sign off or say something's okay and we're putting false information into the record or driving patient care because of information that's incorrect.
So I want you to be brutally honest with us. Have you ever seen an AI tool rolled out in a hospital that we knew wasn't ready, that you knew had the potential to hurt patients, and what happened?
Yeah, I think as a informatics nurse specialist, I would never want that to happen. But of course, we are moving quickly with AI. And what I'm seeing is the technology trying to drive nursing practice. And that is something that I would advocate against, right? We want to use who our people are, what their workflows are, and how we can use technology to support that. So, in looking at kind of wrong use cases or applications of applying AI that doesn't work for nursing, it can put patients at risk if we're applying it incorrectly. I have seen some poor use cases that always could potentially put patients, at risk if we are implementing it in a poor way. And so some of those use cases I've seen that I don't particularly love are like ambient nursing. I feel like that takes a whole different model of how we approach nursing care. So I feel like there are use cases for it in nursing, but applying it to the inpatient setting necessarily is something that I'd like to slow down and really be thoughtful with and seeing if that is the best use case of that application. But does that put patients at risk if we're just dictating our care? Depending on if, again, it has to do with more of the human in the loop, verifying the information that is in the record is accurate, and then signing that off as a nurse.
So I know you've said human in the loop several times, and we continue to hear that. And now I
Mhm.
understand we even have an initial for it, right? HITL. Is that right? I've seen it in,
Yes, yes.
yeah.
Yep. Mhm.
I'm like, how many more initials can we get in healthcare?
Yes.
But so if I'm a nurse, I'm standing at the workstation and an AI alert comes up. What are the two or three things that I need to look at before I act upon that alert? What do I need to consider as that human in the loop?
Yeah, I mean, why it's firing, right? That's with any pop-up that you're getting or alert or, some sort of clinical decision support. Why am I getting this alert? And really taking a moment because if someone has taken the time to build something into the system to try to guide your practice and provide recommendations, it's there for a reason, right? So take a pause, understand why it's firing, and it's always good to verify the information. I've seen alerts fire because inadvertent respiratory rate was, entered in the chart and that made the pop-up fire, right? So it goes really back to those baseline data elements that do contribute to the model. So understanding the why, understanding the data, and then is that the right action for the patient, right? Just because it's providing an alert to me does not mean it's necessarily what I feel is best for the patient. And if things are built correctly, right, you should have that ability to pause.
Yeah. And I think that's the scariest thing to me about AI and alerts because I've practiced and been an expert in patient safety for numerous years. And we do get into alert fatigue. And so, how do we make
Mhm.
sure we've got the right balance between alerts going on? So,
Yes.
Absolutely. So, what's the moment a nurse should stop trusting what the AI is telling them? And what does that moment actually look like at the bedside?
Yeah, if you would get a recommendation from a tool, any tool, whether you know it's AI or it's not, take a moment to pause, right? And if it is the right action for the patient, great, follow its recommendations. But if you strongly feel like that is not correct for the patient, something is wrong, follow your safety protocols. The thing with technology is we can sit in informatics and think things are functioning well and we've designed a great tool, but without your feedback and filling out safe reports, escalating to your management team, looping in your local informaticist, right? We are your best friends in getting that feedback on those tools. And then we can use that, feedback, recommendations, safes. We try to collate all of that information to further enhance the designs. But if definitely there's a safety issue there where it's telling me to intervene and it is the poor choice for the patient, please, use your typical safety escalation pathway.
So you kind of led us right into our next question. It is on that whole safety piece, because we also have heard of several instances where these tools have been incredibly valuable from a safety mechanism. So do you have a real world example of where AI helped the nurse deliver safer care?
Yeah, the example that I have, and what really started my AI journey is when I was a patient care manager at Stanford Healthcare. It was our first AI implementation of a clinical deterioration model provided by our EHR vendor. And having the ability to implement that on the floor, get nurses' feedback, and see it work in real time. Initially I was like, hey, put this on your radar, take a look at it, see what happens. And I would come back in the morning and they'd be like, whoa, Jerri, this told me something was going to happen with the patient. The patient ended up having a code last night. This is really happening. I'm like, yeah, great. Okay, let's see how we can really change the way we provide care, right? And use this. And seeing it work, right? There's that bit of distrust at first, but when you can see it validated like that in real time, it was really helpful. And then we were able to, adjust the workflows, and eventually did see, over a 20% decrease in our patients either having a code event or needing to go to the ICU because we were able to intervene earlier.
Yeah.
Oh,
Awesome
that's really
example.
cool. Wow, that was really cool. So on the flip side of that, can you share a moment when AI didn't perform as expected and what we learned from it?
Yeah, the same tool that I'm talking about, if you don't have the right data going into it, it can flag inadvertently, right? And being able to catch that in real time. And that being said, any of these tools that are in an EHR is clinical decision support is only as good as the workflows that we build around them. And then also adherence to those workflows, right? Because we can have a perfect model, we can have a perfect workflow, but if it doesn't work clinically and things are falling apart and people don't feel like it's valuable to follow that, it really starts to break down, right? So you can have inadvertent flags from the data, but then you can also just see things not really, fold in the way we want them to because of those workflow adherence. So that clinical deterioration model, really what drove the patient outcomes is alerting the team to have a huddle, right? Like talk about the patient, talk about what's going on, what could be going on with the patient. Should we do some sort of intervention early? But had those conversations not happened, we wouldn't have seen that lovely, effect from the tool.
So I think you bring up an interesting point here, because a lot of these tools are very, very dependent on our workflows. And, the biggest argument I hear from nurses is, I don't have time to do real-time documentation. I don't have time to make sure everything's nicely tied up in a bow in the EMR. What do you say to that nurse when they bring that forward to you?
It's a valid fact. It's a busy workplace, and we understand that. There are rules that we can have to build in to have look back times that are reasonable, right? As much as real time documentation is encouraged, it can be very challenging. And that's why having that clinical lens as an informaticist, being involved in building these tools, able to speak to that, right? Like it's not really realistic to expect a nurse to turn around and 15 minutes later document something, right? Unless you're giving them the tools that they need to be able to do that in real time, right? So if you're expecting that of me, what are you providing me to be able to make that happen, right? And so I think that's what we're trying to look at from an informatics perspective is how can we make it easier for you to do these things? How can we use tools within the EHR that they're coming out with that are not necessarily AI, but they're other efficiency tools so that we can make that documentation burden a little bit less. But I definitely feel like AI is having us rethink. It's a very pivotal moment for nursing and really thinking about how do we provide care? Why do we document the way we need to document? Who is looking at that data? Why do we need it? But to your point, some of these tools are really built out on, real-time data, and we really have to address that as a profession if we can sustain that.
Well, and I think it gets us into this whole situation of we as nurses develop the sixth sense, the gut feeling, and how do we teach nurses, especially as we have developing nurses, when do you trust the AI tool, but when do you trust your gut? And who wins in that situation? What does that look like? How do you have any recommendations on that? Because I think it's a true crossroads that we're at as we develop new nurses.
Yeah, and I think that has been a concern from an informatics perspective since the beginning of the specialty in the 90s, because how do we use clinical decision support tools in a way that is meaningful and we are not delaying critical thinking development? And I mean, it goes into academia with nursing and using generative AI tools. How do we foster education, but still using some of these tools, right? With what I'm seeing in practice, and I would recommend is, if you're getting an alert, it's telling you to do something, but your critical thinking isn't quite there yet, check in with a more seasoned nurse that you're comfortable with. Go check in with your charge nurse. Check in, with a mentor or a buddy, and see if they have the same gut check, right? Explain to them what's going on. There's usually someone that can weigh in and try to help if the gut feeling is conflicting with the tool. But yes, it is something that we're continuously mindful of, is how do we help foster critical thinking and yet supporting practice in a way that's meaningful.
Yeah, absolutely. So, when AI causes harm in a clinical setting, a misdeterioration, a wrong recommendation, who is responsible? The nurse who acted on it, the hospital that deployed this tool, or the company that actually built it? Would love your thoughts.
Yeah, I think that really goes into a lot of these ethical, governance principles that we have. It is something I think that we are figuring out as we are looking at implementing these. We're looking at, at a government level, at a local level, the system level, what that looks like. I think, again, if a tool is built correctly, it should never be driving care without a human in the loop, right? So again, our theme, it shouldn't be causing harm without any sort of human oversight, right? And that kind of goes back to I think of it as your five rights for medication administration, right? Like the system can be set up to do that with similar tools, but if you miss a piece along the way, right? And that's usually human error. If I'm going to choose to not scan the barcode today, and that causes a medication error, right? That would be the person choosing not to scan the barcode, right? But if the system is having a system error because it is foundationally built incorrectly, right, then we have to do that root cause analysis of why that would happen. But I would hope that we are building things that have that human oversight where there would be no tool in healthcare touching a patient directly, without those guardrails being in place that would foster, any sort of patient harm.
Well, it takes me back. I'm a little bit more seasoned than the two of you. We'll just say that. But it takes me back to those days where I used to, talk to my nursing staff and say, just because the physician gave you this order doesn't mean that you always follow it. You've got to use your own clinical judgment. So it's kind of the same thing within the AI world and the EMR world.
Yeah. Yep. I feel like AI has been labeled a lot of things, and I feel like it fundamentally goes down to our AI literacy level, right, as a profession. And that's across the whole continuum of being a nurse. But yes, technology has been in nursing for many, many years now, and we have changed our practice and change, and it's always scary when we change, but we always have to use our critical thinking, and we should always be the one that is there, at the bedside saying no and preventing that harm from the patient.
So when you talk about AI literacy, I mean that it's clearly a skill that we all have to develop, and I'm definitely playing with it and trying to develop my own literacy in this. What questions should a nurse start to really ask to learn and to develop that AI literacy for themselves?
I think there is a lot of free education that's being developed. So if you just do a search of AI healthcare, AI nursing, you can find some free courses that exist right now. I would recommend looking at who's providing that, right? Making sure it's from a reputable source. I know Stanford University has a very robust free education platform on AI in healthcare that you could look at. But what I worry about is leaving it up to our end users to develop their own training and education, right? So I don't think we're there yet. And I feel like we're all scrambling, whether it's in academia or it's in driving the workforce development, and how do we keep up with that and what does that look like? But I think understanding what the tools are, right? Basics of their criteria, or it's prompt based, or how are these being built? But then asking questions. I mean, if someone's implementing something into your care, there's going to be training involved at some point. Asking those questions, well, who can I ask about that? How, was this? There's training involved at some point, like what patient data set was used to train this, because there's always bias, there's hallucinations, so it's making things up, or just understanding what those tools are.
I think AI coming, into our lives and also in healthcare in a more profound way has really, brought the technology component to life when it comes to nursing. Like we knew it was there, you going from paper charting to an EHR and, manually titrating medications to pumps now. And so, when a new AI tool shows up in your hospital, what should nurses feel empowered to ask about these tools?
First off, who was the nurse that helped develop this? That would be my question. Who at our organization, from a nursing perspective, was there to help be the voice of nursing and developing this workflow, right? Probably not going to be on the data scientist arm of it when developing the model itself. We're talking about model validation. But again, those workflows, right? Based on whatever the tool is recommending the outcome be, there's workflows involved. And if it touches nursing, I want to know who that was, like who was involved. Was there a nurse, right? And that's where I think we need to be noisy about, sorry, noisy
Probably a
and
combination,
nosy
noisy and nosy.
and both. Yes, you're right. To be able to ask, there needs to be nursing at the table, right? So do you have an informaticist that become friends with them, right? They will probably have an insight or should have an insight into that. But there's the questions of what patient group was this tested on? Was there a nurse involved? Are you aware of any bias that we could be seeing? Have you seen this hallucinate at all? And, what is the accuracy level? Who validated this? How do we know that this is providing accurate information to us? Those are some basic questions if you really want to start feeling more comfortable and have that AI literacy level. Those would be the questions that I would be asking and recommend to ask.
Well, Jerri, you're truly an inspiration. You started as an LPN. You've worked your way, through your now to graduate level education. You've worked on the floor. You said, I'm not going to accept status quo. I'm going to make sure that I'm involved in building the next generation of tools. So I know, many times I feel like technology is moving faster than I can keep up with it. If I'm a bedside clinician, what do I need to know to stay up to date? And how do I stay up to date?
Yeah, I mean, ask questions. If your organization is not providing education on AI, ask about it, right? Again, it's just if we don't have the tickets, we don't know what's happening, right? And so we understand there's a need, but I think putting pressure is okay, asking the same question, squeaky wheel gets the grease kind of thing. Knowing who your partners are at your organization that are helping make those decisions, right? If you're truly interested in that. Looking at some evidence-based education, there are new, it's being published every day if you go, right, on new AI literacy, and they're publishing in the free space. So you should just be able to use a search engine and find those tools, and they're really helpful. So I would recommend using that free education. A lot of healthcare organizations have access to those libraries. So even if they're not free, looking into those resources and seeing if there is education available at that point. But yeah, being more comfortable getting to know what is AI use in healthcare. And I think while the demand feels very urgent, it feels very much like it's here. What are we going to do? I do think it's challenging for healthcare systems to move at that same pace, right? We have to worry about funding, right? With these generative tools, you have to pay per token. So you have to pay each time these tools generate information. And some organizations realize, we can't keep up with this, right? Or it's not the best use case. So while I know it feels a bit stressful and like it's here, take the time to educate yourself and know that there are people, within the informatics space who really are trying to advocate for us to be intentional with how we apply this into nursing practice, and get to know those people and find out what's going on.
Well, I just appreciate you so much and sharing your time and expertise with us today. And I'm excited to see where you continue to go, because clearly the sky is the limit for you. So thank you, Jerri, for being with us.
Well, thank you so much for having me. So it's always fun to talk about AI. So appreciate it.
Well, we will keep that in mind, and we might be calling on you again. So
sounds good.
And lastly, I just want to thank our listeners for joining us today. We would appreciate your feedback on this episode and ideas for future episodes at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's online course, Essentials of Critical Care Orientation, or ECHO, providing modular, interactive, case-based orientation for ICU or PCU patient care, with information available at www.aacn.org/orientationcc.